You're tuned to Radio Kidnappers, the voice of Hawke's Bay. This is the Acupuncture on Air program. Our pleasure, as always, to have in the hot seat in the studio Heiko from the Acupuncture Clinic in Hastings. How you going, Heiko?
I'm really good, Ken, and you? And how you been dealing with that windy weather we've been getting?
Well, it's been windy and it's been cold.
I know. Well, I think it's supposed to be. It's going to be 1st of June very soon.
Yeah, that's
officially,
right.
That's winter.
Well,
So
as we record this program, I was just seeing the forecast for tomorrow morning is 1 degree.
Oh, that's a proper good winter, you know.
That's right. Anyway, before we get on to today's topic of conversation, which is Chinese herbs for rheumatoid arthritis, where are you? How do we get hold of you?
I'm in Charles Street in Hastings, just diagonally opposite the Pack and Save there, 206 Charles Street. But go to my website, acu123.co.nz.
Just looking at that word rheumatoid, ending in oid, it always reminds me of hemorrhoids. I suppose there's acupuncture for hemorrhoids, is there?
There is. Should we have like a picture show?
Yes,
Because now that's being filmed, I could have like a slideshow up here.
Yeah, why not? That'd be awesome, wouldn't it? Anyway, tell us about Chinese herbs for rheumatoid arthritis.
Well, that's why I was just mentioning about that, that we've had the cold weather and we've had the windy weather.
Yeah.
And that's quite significant for this show because Chinese medicine looks at the cause for like arthritis. We have a different word for it in the traditional sense, and we used to call it, or it's called B syndrome. That doesn't mean anything from a Western or translation point of view, but it fundamentally relates back to that we say that the elements from the environmental factors, wind, cold, damp and heat, they can penetrate the body per se, and they go into areas of weakness, and then they accumulate.
Yeah.
And it's a bit like it's like a build-up of damp or a build-up of wind. And of course people think, that's crazy. But even Western medical science will say that, rheumatoid arthritis sufferers who've done the research, and yes, they suffer more pain when the weather changes and it gets cold. And they have more stiffness, like when if the humidity measures below certain blah blah. So they'll accept that, but they won't accept that it could actually be the cause of.
I thought that was just an old wives' tale. It's not.
No. That's why when you hear about those old not old blokes like us, but blokes older than us, right? When they say, look, I can guarantee, I can tell you when it's going to rain because my knee starts to ache. My old motorbike injury, my knee starts to ache, and that's when my rheumatism will get really bad.
I wonder though if you said to someone, for instance, I don't know, say who lives in the tropics, where it's nice and warm all the time, they have rheumatoid arthritis up there, don't they? They
do, but then they have what we call hot and damp arthritis, and then they're different types of symptoms, and ones that get worse. And I mean, I've had patients who have said, like, I had a little bit of arthritis here, but then I moved to Townsville for 3 months for work, and it was shocking over there. And I would have thought it got better, but see, they actually have a hot form of arthritis.
Oh, right.
And then someone else from a warm climate moves to a cold climate actually feels a bit better.
Yeah.
And then people will say, my arthritis, and this is where we say if wind is the predominant pathogen or the environmental factor, wind type rheumatoid arthritis moves around. It's like, one day it's sore in the elbow, one day it's sore in the shoulder, and then it's sore in the foot. And this is because wind moves around.
Yeah. I wonder, we presume that rheumatism and arthritis are inevitable as our aging.
As an aging process.
Is it inevitable?
I mean, what you'll find, and this is actually one thing what ACC, the government insurance company, they have a bit of a trick that they use. Like if you go along and you say, I've hurt my ankle, and then I've tripped over in a pothole, and then it doesn't quite get better and it's still sore, and then you get off and you'll have some extra x-rays and some things, and so, look, we've done an x-ray and you actually have arthritis there, we can see that in the x-ray. But the problem is that every single person over the age of 40 has some form of arthritis that you can see on an x-ray. And it is an inevitable part. It's as common as wrinkles, but as you know, some people have more wrinkles than others, and some people have more arthritis, and some people have a worse heart than others. It comes down to your sort of constitution and I guess the lifestyle that you had leading up to that point in time where you are at the moment.
Yeah. Now you've got some interesting news for us about the World Health Organization.
Yeah, and that's an interesting thing is because often, particularly, you meet the so-called, the researchers and the skeptics, and everything's got to be in line with Westminster. But none of that is proven or scientific, and it's all like nonsense. But now what we can actually use in our favour is that the World Health Organization has now actually acknowledged and recognised that what's called TCM, Traditional Chinese Medicine Diagnosis, is a valid system of diagnosis in their systems, so that they can no longer sort of say, oh well, it's just rubbish. When you say, well, if it's rubbish, then why is it part of the World Health Organization?
It's only taken them 3,500 years to get around to it.
That's right, and what we've also found is that with the World Health Organization, they really do work in our favour, because they slowly acknowledged acupuncture, then they acknowledged that acupuncture can treat certain conditions. Now they've acknowledged that the diagnosis for it is actually a valid system. So they're all little pluses.
Yeah, that all adds up. And I suppose if you're saying cold causes rheumatoid.
No, you're a retard.
Yeah.
You're
rheumatoid arthritis. Then we should be having some sort of hot herb like ginger, maybe.
And you're on the right track there. That's how Chinese medicine sort of looks at it, like that. First, we have a look at the signs. If it gets worse for cold, and if it's stiff when the cold weather comes, and we can more or less say that cold is the cause. And we do have warming type treatments for that, and warming treatments meaning herbs that have a warm property, is exactly as you've said, is ginger. But what we find is that dried ginger is actually better than the fresh ginger.
Really?
We say the fresh ginger is warming, whereas the dried ginger is hot.
Yeah.
And another sort of hot-natured herbs is something, say, like cinnamon.
Yeah.
And then we have another one, it might be prepared aconite that's been prepared in a certain way so that it's not toxic. Then we have something like cloves.
Chilies and curries and that sort of stuff.
Yeah, some of these, they're the things, and we have different types of peppers. We have a Sichuan pepper, and these are sort of hot, and we say disperse the cold out of the joints or out of the the areas where the rheumatoid arthritis is.
If people eat that sort of stuff, I eat quite a lot of chili, and it's likely again later on in my life that I probably will later on. Geez, I haven't got much to go.
Well, maybe in 30 years' time.
Yeah, maybe. Then how can we still get it?
Well, it comes down to constitution and many other factors, and what you might find that you may not get it, and some people they get it when they're 40, they start to get swollen joints or something. Everyone has their strengths and weaknesses. You might have a particularly good heart for your age, but you might have bad gallbladder or whatever.
Fair enough. So what are we going to do? We're going to go out and start eating in cinnamon bark, cinnamon twigs, cloves, different types of peppers. Is that the go? Well,
it's not as simple as that. It really needs to come down to an accurate diagnosis of that person and have a formula made for them to suit them. And for example, if you've actually got an imbalance with your stomach, and I have mentioned this on show before, that sometimes you can have an imbalance, cold in one area and hot in another area, and so you might actually have a hot type stomach, and so then if you have these hot herbs, it actually aggravates people, feel worse for it. And that's a thing, like something like curcumin at the moment is a big thing for inflammation, because they've done a bit of a test and they've shown it changes inflammation in the petri dish, so let's just do a big concentrated pill of curcumin and it's going to help for inflammation. And in many cases it does, but in many other cases too, it really aggravates the people's stomach, particularly if I've got patients who've got ulcerative colitis or Crohn's disease or irritable bowel, and they say they take it and then it triggers off all these other problems, because it's too hot, it's too imbalanced. Chinese medicine would balance the formula there, and you might have 4 or 5 of the hot herbs, but then you have some other herbs that treat the stomach, treat the spleen, move the blood. If you've got a bit of a weak heart, we might give you some herbs for the heart. So you get this balanced component of a mixture of herbs.
So you're going to give us a balanced herbal remedy. If I was going to a traditional practitioner of medicine, what would they give me?
Well, they would give you like an anti-inflam or like a painkiller or whatever it is. And I know for some of the arthritis now that they use like methotrexate, which is actually a chemotherapy drug. It's very, and it does help to bring down, but eventually it damages your liver so much you have to stop the the drug, and you end up with a bad liver as well.
Wow. Okay, now you mentioned damp before, so what happens if we move down to a place like Dunedin where it's damper than what we are here? Does that mean we're going to get damp rheumatism?
And that's right, and I did work in Dunedin for about 18 months, and then you sort of see different people with different patterns, because it was, for me, from Sydney to Dunedin was quite different, the types of people coming in with their conditions. And and Dunedin it is a very cold, damp place.
Yes.
And the damp, that it settles there, it makes their muscles very heavy and very tired. So we use herbs that we say resolve damp, and one of them that I've mentioned on the show a few times, which is one that's simple and safe and easy to take and obtain, is pearl barley. And you can buy that like from the supermarket, or you can get a slightly different species of barley from the Chinese, Asian grocery stores. You have that with soups, or you can just have it as a simple tea if you want. And we say that it has a mild diuretic function, and we say that to basically to discharge the toxins from the rheumatoid arthritis.
Okay, so if we're doing that for the hot climate like we have here, we've covered the cold climate. What about windy Wellington?
Windy Wellington, and we have certain herbs that they're in a category of in our textbook that we say to disperse wind and disperse or remove wind damp. And particularly in Wellington, I think if people are living there, but also we've got to look at it. It's not so much that the place might be more windy. It's how is the person, how are they adapted to living to the environment? Like you, for example, be working indoors in a radio station. You're going from the car straight to the studio. You're not getting exposed to the thing. But if you were, say, I don't know, a roof tiler or working on the roads in Wellington, it'd be quite different, because you're constantly getting exposed to the wind. I remember in Sydney, I used to have quite a few patients that worked on the ferries, and so they were always getting exposed to the wind and the wet. And even though they might have had jackets and stuff on, but they're constantly just getting bombarded by it. So they all had the different types of, wind and complaints. Simple herb that you can use for that, and again, it's available from Chinese, Asian grocery. So it's called Sangji Shen. I'll put that onto the comment section onto the YouTube. It's a type of vine that grows on mulberry trees. And you can cook that in like as a herb tea. That's the simplest and most easiest way. And we have many other specialist herbs, like for example, like if you have problem more in the upper body, there's one herb, it's called Jiang Ho. And then if the problem's more in the lower body, it's Du Ho. So it's if it's in the lower back, there's different ones. So and that comes down to, again, the diagnosis, and then tailor making a formula that's suited to the individual needs of that person.
Indeed. Something for everyone at your place, that's for sure.
That's right, yeah.
Before we get to the end of the show, because you've got another awesome song, I can see that. just remind our listeners, where do we come and see you?
I'm in Hastings, and my colleague John, he's got his own clinic down in Masterton. He's at 49 Church Street. But go to the website, acu123.co.nz.
And what song have you got for us?
Well, it must be one of your favourites, is it? It's from a guy that, of course, you know all about him, Peter Tosh.
As soon as I saw the name, I thought, yes, the only thing I know of Peter Tosh is reggae. But
and the song is Downpresser Man from his album Equal Rights.
No doubt it will be awesome. So without further ado, good on you, Heiko. Good to talk to you. Talk to you same time, same place next time.
Okay, all the best.